afternoon, everyone. Thank you for joining us. This is our quarterly Mbqip webinar, and we're lucky we're joined by Laura Grangard Johnson. She works with Robin and Sarah and Carla with Stratus Health. They are the Rural Quality Improvement Technical Assistance Provider, or RQTA for short. They are our go-to folks for everything quality reporting and improvements. We rely heavily on their team. Today, Laura's going to be going over the Edtc collection tool, which I mentioned earlier before some folks joined. Works out well because we'll be opening the second quarter Edtc submission next Friday. We are a smaller group today. I am recording this, but if you have any questions, feel free to unmute yourself or put something in the chat, and I'll be watching the chat. With that said, Laura, I'll turn it over to you.
Super, thanks a ton. Happy to be here. This was relatively informal, so my hope is to do a demonstration from start to finish on how to use this tool, access it, run reports, things like that. Some of you may be familiar with this already, and some might be new. So as Laura said, if you have questions, feel free to chime in if you have them too. I can answer them as we go. Otherwise, we can take a break at the end too. So the tool that I'm going to review is something that Stratus Health has put out. It's an Excel-based tool. It's one way you can collect this data, and most states do use this. Most hospitals do use this. It's on this website here. I'm going to stick this in the chat real quick. I'm sure everybody's got access to this already too, but just in case you want to follow along or anything like that, here's where it's accessed. And you'll find everything related to the Edtc measure itself on this page too. So if I'm scrolling down, data specs resources, if you've talked with Robin, she'll always point you to the data specs manual. That stuff's here. Just as an FYI, we're specifically focusing on the data collection tool today. There's a couple different, actually 3 different versions of it. Most folks really do only use one of these, but it kind of depends a little bit on your hospital. So there's 2 versions that use macros, and those let it be a little bit more automated and use buttons, and that's what I'll demonstrate today. One of them is for folks that have much older versions of Excel. I don't know how common this is anymore, but it's still available as a just in case. And then this one is for the second one here. If you can see where my mouse is the more current versions of Excel. And then if you've got kind of IT doesn't like you to run macros or you have issues, we have put out one that really just uses equations and it's not quite as automated, doesn't check your work to make sure things are the correct dates, things like that, but that is available. I won't demo it today, but just an FYI. And then there's a couple resources I'll just alert you to that are underneath those 3 tools. The manual has screenshots and it walks through in just sort of a different format what I'm walking through today, and then a video, which will be somewhat similar to this as well. So that's what this is. To download these, you're just going to click on the link. And what it does for me is it pops it open in Excel Online, which may or may not be something that happens with you guys too. What you'll do is download the file, and I had some issues with my Edge today, so I'm just going to show you what this ends up looking like. But if you download the file, it's going to ask you where you want to save it, and you can do a save as, and I'm popping up what I've got here to show you what this looks like. So once you've clicked download and you're choosing where to save as for the very first time, you want to pick somewhere logical to access it. And what we usually recommend is you want to put it somewhere kind of on a network drive so that if you're the main person entering data, that's great, but so other folks can access it if needed. Desktops aren't as good of a location ideally. So create a folder that's somewhere, if you think about using the tool over the years, if you want to have different versions, you can really keep it straight. When you've saved it, you can name the tool whatever you want to. So this is kind of the default name that it gives you. Feel free to change it to something more intuitive for you. One thing I'll note, so you said that this opens up like I was showing here in Excel Online. If this is something your hospital has, you do want to make sure you're using it not in the online version. So opening it in actual Excel is what's going to be necessary. I'll pause there. Did that all make sense? I know Microsoft is evolving, so hopefully that's something that you're all familiar with. Shoot a message in the chat if not. So once you've downloaded and saved the tool, you've got it in your location. That's the only time you're going to have to do that unless you want a new version. Some people like to start a new clean tool for each calendar year. If you've been around a while, we really did recommend that historically years ago because the data would get the tool would get kind of laggy and slow. It's improved a lot. We don't have to do that anymore. So it's up to you if you want to have a new tool for each calendar year, but this is a standalone Excel document. So once you've downloaded it, that's what you're going to use as the downloaded version for everything. So once you've got it downloaded, you'll notice I have one named here that's for demo, and that's what I'm going to show you all today. You're going to double click on it and it will open up for you. And this is roughly what it's going to look like upon opening. The first ever time you open it, it's going to ask if you want to enable macros, and you are going to need to do that. Check the manual for the screenshots of what that looks like. I can't demo that specifically because once it's done, it doesn't come up anymore. So I can't recreate it since I've had this tool for so long. But it really is just clicking enable macros and then editing the tool, and it'll look almost exactly like this. From here, you're going to enter your hospital information. So you'll see I have sample hospital, a fake CCN number in my state. That'll populate to your report going forward. As a general cue throughout this entire tool, anything that's shaded this color of yellow is something you can edit. So once you've got this info entered, you're going to click here to start data collection. And just so that it helps with demonstration purposes, I've got a whole bunch of information in here already. For your orientation, this is your patient list page. So this is going to show sort of a little quick snapshot of what's in your tool. I'm scrolling down, you'll see you've got 22 records in here. There's a queue at the top that tells you how many there are. It's got a snapshot of the information, and your data, as you enter it, will keep populating to this. I'll orient you to what's at the top here real quick, and then we'll go through the data entry in a little bit more detail. But all of these here are buttons. I think they're pretty self-explanatory. So go back to that initial page if you want to change something. You can add a new record with this button, and then there's the ability to open and edit or delete records. To do that, you're going to collect, or you're going to click on the medical record number of a certain record and open and edit or delete from there. And then there's these report buttons at the very top. So this is your sort of navigation page where you can do everything within the tool. I will show you how to add a new record, and then we'll kind of go into some more detail with some of these things. So if you want to add a new record to your Edtc, you'll click add a new record and enter the information again. So you've got these yellow boxes as your cues. So I'll just show you kind of how this goes. I'm going to enter the name of myself, a medical record number, or whatever you want for an identifier. I'm just picking kind of random things. You've got a drop-down list to the patient discharge disposition. And then you've got a date of patient encounter. I'm going to click something that's this year. From here, it's your yes, no, NA type questions. All of this corresponds directly to the paper tool that is in the manual that I'm sure Robin has gone over in the past too. So you can look at that for kind of a paper copy of this or abstract as you go. People have different approaches. I'll click through. We'll answer yes for all of these. It's just a drop down that's populated with what the options are for each of these questions. Say this part of the demo is much faster than it used to be when there are 27 elements. So there's only 8 now. Once you've gotten to the bottom, you'll click save. If you want to retain that record, if for some reason you're like, oh shoot, I didn't actually want to enter this yet, you can hit cancel. But here, I'm going to hit save. as long as it's a new medical record number with a new date combined, it's going to tell you this is a new record and ask if you want to add it to the database. And we want to save this. So I'm going to click yes. It will think for just a moment, and then it will give you a message that says saved. So you're going to click OK from there. And if I look at the top, the total records in the tool was 22. It's now 23. Scrolling down, you'll see that new record at the very bottom here. So from there, we've got a record in. If I wanted to get rid of this, I would click on the medical record number and then click delete record. I'm going to try that with a different record because I want to show you something with the 2022 when we get to the reports. But here's A13. I'm going to click delete record. It's going to ask you if you're really sure. It can't be undone. If you're really, really sure, hit yes, and then you'll see that that has disappeared. One thing, and this is noted in red here, if you want to delete a record, don't use your keyboard, use the button. What you're seeing on this page is sort of a little snapshot of the data that's stored in the tool and used for all your reports, but it's not the actual data. So if you delete this here, it's not actually going to delete the record and it can cause issues. So just make sure if you're trying to do anything within the tool, use these buttons to make that happen. So that's delete. If you want to open and look at a record, or if you want to make a change, say you accidentally hit no and you meant yes for something, this is how you'll do that. So here's my record that I just entered for the patient encounter on May 1st. I'm going to click open edit record after selecting it, and you'll see a note come up. It's probably really small text with Zoom, but one thing to note, so the way that we think of a unique record is the combination of the patient ID and the date. So you really only want one record per date. If you want to edit either of those, if you had it, you wrote the wrong date in, what you'll need to do is make the changes, but it'll duplicate and you'll have to delete it. So let me 1 second here, show you what that looks like. Is this making sense so far? Laura, are there any questions? It's a lot of information at once, and I know it's kind of tiny.
I'm not seeing any questions yet.
Super. Okay, so let me show you what this looks like. If I change the date. So here, say this person, oh shoot, I actually meant to have them be on May 2nd. I'm going to change that date to May 2nd here. I made that mistake. That's the only change I had, so I'm going to save it. What it's going to tell me is that this is a new record, and that's because, like I said, the way that it looks at a unique patient transfer encounter is that combination of that record and the patient encounter date. So it's going to think it's a new record. Technically it is. You want to add it to the database. It'll give that same message that it was saved. So you see here, we got a May 1st and May 2nd. This is the one that we had entered initially. So if this scenario happens and you mistype something with that medical record number or the date, you do exactly what I just did, and then you just delete the one that was incorrect. So in this case, I meant to be May 2nd. I didn't want that May 1st. I'm going to delete that record. Hopefully that makes sense. I don't think this happens a ton, and I think it's hopefully clear enough with the pop-up and in the manual if it encounters it, but just flagging that if that's the thing you're changing, that's why that's happening. If you wanted to change something that's actually just the responses in here, yeses and nos, you can do that with no issue and save it, and it will be just fine. It will update that record. So that is data entry. From here, you've got a couple options for running reports. And I'll show you roughly what each of these looks like, starting from the right one here. So, and Laura, I'll ask you to speak to this just if this is specifically how you want to receive information, but you've got run a report for Mbqip that's going to spit out kind of an ugly Excel report that has the data you need to submit. You've got run a report by discharge, disposition, and you've got that little kind of break things down by what you've got in this column, and then you've got monthly report. If you want to look at things at a monthly basis instead of quarterly, like what's needed for your flex reporting, that's that ability. So I'll click Run a Report for Mbqip.
Hey, Laura, this is
Yeah.
Laura. So what we do is we do a SurveyMonkey each quarter. And so I send out a SurveyMonkey link. And so I think what we're going to get from this report would give everyone the values to complete
Perfect.
that survey.
That it will. And I will tie that together to this for you. This is sometimes a little bit slow, so bear with me here. It's the macros running. All right, so here is the Mbqip report. And it should have everything you need on it for your reporting purposes. So what you'll see here, and I get questions about this sometimes, is 2020 data. And so when I was on that patient list page, most of the data in there was from 2020. So that's what this is summarizing. If you have multiple years worth of data in your tool, all you have to do is update this year of report to the one of interest. So I'll hit 2022 and then hit enter or click, and that will automatically update. Oops, sorry. So what you've got here, it takes a minute to update. I entered that one record that was May 1st. You've got a bunch of NAs otherwise, which lines up perfectly. We only have that one patient transfer record for 2022. It'll summarize based on what you've got in there for whatever year is entered in this yellow box. Sometimes it takes a minute to refresh, like I said, and if it isn't, you can force it to do that by clicking this refresh report button here. The thing I'll say about all these reports is they take just a second to update. So just be patient. They will eventually spit out the numbers. It's not too bad, but there is something happening even though it takes it a minute. So for your reporting purposes here, this should line up with what you need in the SurveyMonkey. So you've got your 8 data elements, your N here. These are your numerators for what you need to enter for the Edtc measure for the quarter, and then your records reviewed here underneath the Q2 2022. In this scenario, we only have one, is 1, and that's what you'll enter. If for any reason you want to print a report, you can do that and click that. It will bring up a little screen that lets you pick which printer you want to use. And if for any reason you want this data exported, it would be exactly what you're seeing here, but in a really ugly format. You can click that export report for submission button and it will spit it out in the same folder wherever your tool itself is housed. Doesn't sound like that's something you'll need, but if for some reason for your other purposes you want it, that's what that button will do. If you want to get back to your patient list, you just click this button here and that'll bring you back. These 2 other buttons here do similar things, but slightly different reports. So the report by discharge disposition is really similar to the one I just showed you for Mbqip, but rather than being all of your records combined, there's an additional little drop down that's going to let us pick the specific group we want. So part of the reason we did that is frequently in the past, there was a little bit of a difference between patients who went to places like skilled nursing facilities versus other places that they're sent to, and it's the ability to do a little bit of quality improvement and look at how your performance is in general across the board compared to different discharge dispositions. So like I said, there's this discharge disposition drop down. This is going to give you all of the options there are for discharge dispositions. You can pick one and refresh the report and it will run based just on those. And I think if you return to the patient list, this monthly report is similar, but monthly. A few other small notes based on the way you're collecting data. I don't think this is too much of an issue, but just a reminder, this information is medical record numbers usually is what folks use to enter. And so there's PHI in here, even if you're emailing a report directly from this tool, you want to make sure if you are doing that, that you're doing either that really ugly version that's exported or the printed screenshot, something that doesn't email the entire tool itself, because that data does live within the tool. So just to be cognizant of that. So yes, here's the monthly version. It looks really similar to the others. Takes a little bit longer to load since there's 12 months instead of 4 quarters. But if you scroll down, you'll see all 12 months listed. So if that's helpful for QI purposes, that's why that's there too. So that's the tool. Any questions on the demo, on use, any issues you've run into, anything I went way too fast that you want me to revisit?
I have a question.
Yeah.
So I missed the very first part of this meeting. Is this just something for us to be able to download on ours to monitor our ED communication?
Correct. Yep. So each hospital would have one of these tools. I'll go back to where it lives. And I'll put that in chat again too. So this tool is housed on the Stratus Health website. You download it once per year, once in general, but it's just a one-time or minimal download time used for you to enter your own hospital's information, and then you submit it to Laura quarterly via that SurveyMonkey. Did that answer your question?
Yes.
I'll stick this in the chat again too here.
Yes, and along with the recording link, I'll also send out the link to download it and access all the tools too.
Okay, and then at the end of every quarter, we send this to Laura?
Yes, we send out the SurveyMonkey link for your quarterly EDTC submission. So we'll still send out the link where you'll still enter your data using the link, but this is a good way to stay on top of your data throughout the quarter. It makes it a little bit easier and also kind of answer some of the questions, kind of abstraction type questions as you go along.
Yeah, there's not. It's a way to calculate the measure that's automated and easier for your submission to the Flex program via that SurveyMonkey. We at Arkita, or the TA provider and kind of the hosts of this tool, we aren't involved in the data submission process. We can answer questions about how to use it and the specifications and abstraction in the case of Robin. And if you run into issues, we can help fix things like that. But the process of tracking on the data and calculating the measures within the tool is the hospital's, you all, and then it goes to Lara for Flex reporting.
Yeah, and so once we get everyone's submission in via the SurveyMonkey link, we submit a state spreadsheet with everyone's data back to the federal office, and then we're generated those reports that we send out from the Flex monitoring team. So we're not changing our process for submitting. I've heard from many folks that this is very beneficial to use the EDTC collection tool to stay on top of everything. And I know we have a lot of new quality folks. And so I thought it'd be a great opportunity for Laura to share this. And then we can also have it on demand as we move forward in terms of videos on our YouTube channel.
Laura, do you know if this, something like this is available for OP2, 3, and 18?
Unfortunately, since those go on to CMS, no, you still have to use CART
Okay.
to get your file together to submit via HARP. Trust me,
Okay.
I wish we could do I wish we could submit all of our measures like we do EDTC.
Yeah, that'd be awesome.
Very awesome.
I am so frustrated with HARP and CART and all that baloney.
I know. I'm sorry. Thanks for hanging in there though.
Yeah, I tried to update our, submission tool or whatever,
Mhm.
and it took me out. It usually takes me about 3 hours to get all that because it's always messed up.
The cart update.
Yes.
Yeah. One day we will do only ECQMs. One day. Right, Laura?
It is moving in that direction, yes. I think CMS is a little optimistic about how quickly, but I think it's coming.
Okay.
Are there any other questions for Laura or the EDTC collection tool or some of the EDTC resources? I will note the site that Laura's put in the chat, and I will send out in the email, has all of the EDTC resources put together by her team. So like the specifications guide is on there with some of the frequently asked questions, which I actually referred to the other day, but they're all housed on that singular site there.
Anything that's whatever's most up to date will be here. There was a specifications review. That's why this says Q1 2020 here. A couple of years back. We're not anticipating more reviews of that, but whatever is housed on this page is whatever the most up-to-date version of anything is. So if you're ever wondering if you have a legacy document that you find within your files or anything, this is where you'll want to check.
Are there any other questions or any other tips that folks have found to make it easier to stay on top of EDTC throughout the quarter?
Laura, this is Emily from O'Keene. What I do is every day I check my ERs for transfers, and I've come up with a like an Excel spreadsheet that the nurses go and check, that everything was sent when they do their transfer. It's attached to their EMTALA form. So they turn that in and we put it in the chart, and then that's kind of how I do mine. And then it goes through and answers each one of these questions.
Okay, good.
And then I just make sure on every day that I'm checking it that, they're all answered, and if not, why. That way the nurses know what we need and why we need it.
So you do this every day?
Yeah, I check ERs every day for transfers.
So then if you notice like the next day, like, hey, we missed one, you're able to make adjustments within like 24 hours or so, right?
Yep.
That's good, because I know a lot of folks, look at it at the end of the quarter. So that's a really good idea.
Yeah, that's kind of how, we've had some months that, we'll miss one or two, but mostly I think we've been 100% for, I don't know how long. It's been a while.
Yeah.
But, and then I can get with the nurse and they figure it out whenever you make them correct it, what happened or why didn't you send this?
That's good.
That sounds great.
It doesn't take me, just a few minutes to run through them that way.
That's good. Does anyone else have anything they'd like to share, or tips or ideas? All right. Well, does anyone have any questions? One last chance. Well, as I mentioned, we are recording today. Once we get this posted to our YouTube channel, I'll be sure to send out the link along with the link to accessing the resources. If you get in there and have any questions at all, please let me know. I will send it to Laura.
Absolutely. I was going to say, I'm happy to help with any follow-ups. It's a little bit hard sometimes the demo to think of questions if you have them until you're using the tool, if this is new to you. So we are here to help and answer any question, no matter what the question might be. And if you run into issues with it too, that's our role. So.
Yes. Well, thank you, Laura, for your time, and thank you for sharing with us. And everyone, thank you for joining today.